Hi, I'm Dr. Bill Lyle, and I practice obstetrics and gynecology. I'm board certified in obstetrics and gynecology. I'm licensed to practice medicine in both Florida and Alabama. 2020 is very different from 2019. With the advent of the COVID-19 virus, life has changed. Life has changed here in the hospital, and life has changed outside of the hospital. We no longer have restaurants that are open. We no longer have malls that are open. Schools have been closed. Gatherings of more than 10 people have been halted. Live sports have been stopped. Life is very different. Has life changed here in the hospital? Sure. One of the happiest time in somebody's life, and the only time when somebody is happy to go to the hospital, is when they're having a baby, and that has been changed now. Can you bring your home family into the hospital? No. You can bring one support person into the hospitals now when you're having a baby. What about if you're getting admitted to the hospital for other emergency reasons? Most hospitals are saying, I'm sorry, we just can't have any guests. 0 guests while you're here sick in the hospital. We are doing our best to conserve resources here at the hospital. In fact, we have a shortage of lots of different items, such as N95 masks. We have people in the community who are Mike Lindell from My Pillow. He's no longer making pillows right now. He's making surgical masks. We have changed the way we practice medicine trying to fight this infection. Surgeries are being delayed. Prostate surgery, cancer surgery are being delayed for sometimes months because we have a limited number of resources, and we have devoted so many resources to fighting this virus. Well, when it comes to our community resources, where does abortion fall? Is abortion considered an emergency service that must be provided? How can health care be considered an abortion? An abortion is not healthy. An abortion is not care. An abortion is taking the life of a baby in the womb. We can see that new life begins at that moment of conception. 18 days later, we can see that heartbeat. We treat the preborn as patients. When necessary, we can do blood transfusions as early as 18 weeks gestation. Centers around the country are now doing heart surgery and neurosurgery as early as 22 weeks gestation. So when people are criticizing the president, who is looking forward to Easter to have a resurrection, he wants us to go to church, a resurrection of our economy. He's looking to get things going, and people are criticizing him. Congress people are criticizing our president, saying it's all about the economy. The economy is what's important to him. It's not lives that are being lost that are important to him. I'm like, these are the same people who are saying that abortion must maintain and be a provider to all the people of the United States during this medical crisis. Abortion is not an emergency. Abortion is taking of a human life, plain and simple. Do we need to support people who are in a crisis pregnancy, who don't know where to turn? Absolutely. We are here for them, and we are here to support them, and we are here to support their family. Not only medically, but psychologically, spiritually, and emotionally. They deserve our support. Some states are taking steps. Ohio and Texas and other states are now saying, you know what? With a shortage of resources and with the medical emergency we are facing, abortion is not necessary. Not necessary this week, not necessary next week, but I would say abortion is never medically necessary, because a patient is a person, no matter how small. And if it is a patient, it is a person. And if it's a person, it deserves our protection. Why do we face this virus? Some people are saying, is God angry with us? I don't know. I'm not smart enough to say if this is something that God allowed on our land. What I do know when I read through Judges 3, 4, 5, and 6 is that God loved the children of Israel. That God also said, and the children of Israel did evil in the sight of the Lord. And what happened? God delivered them into the hands of their enemy. God strengthened their enemy. That was the people that he loved more than anybody else. Yet he also did not appreciate when they did evil in the sight of the Lord. 62 million children in the United States have been aborted. Almost 1 million babies a year have been aborted each year. Is that doing evil in the sight of the Lord? Yeah, because we were created in the image of God. When? We were created in the image of God at that moment of conception. So just something to think about. Take care of yourselves. Take care of your family. Try to stay away from contact with other people. The cure for this is having the spread stop. And the way this is kept from spreading is by just staying in your homes. It's not going to sneak into your home. Wash your hands, take care of yourselves, and avoid contact with other people. Pray. Pray, read your Bible. This is the best way to pass this time of quarantine. But we also need to stand up for the preborn. I thank the pregnancy centers that are still fighting for the lives of the preborn, that are still providing services for troubled moms who are facing troubled circumstances. God bless you. If you have any questions, you can get a hold of me through my website, prolifedoc.org. And remember, abortion is never considered health care.